Hi there, I'm Dr. Chung and welcome to your friendly proctologist. In this space and on this channel we discuss the health of your bottom end, and I hope you can relate or learn a thing or two. Please like and subscribe and ring that bell so you don't miss another video, and feel free to leave a comment. Let me know how I'm doing, and if you have any questions I make sure to answer them in a future video as well. Today I want to discuss a piece of equipment or technology that I use in my office on a daily basis, and that is called a proctoscope. If we were to break that word down, procto means rectum and scope means to look through, a piece of equipment to look through, right? And the procedure by which that is called is proctoscopy. So this piece of equipment is used to look deeper inside our GI system, right? I'll leave a link for anoscopy up here and in the description, but where the anoscopy leaves off, the proctoscope then can move forward if the problem is up higher into your intestine. So let's talk about the anatomy first. So I've got a picture of the rectum here with the anus. The anus is at the very bottom and you see the muscles here for control. The rectum is connected to the anus and it's in this space up here, which is inside your pelvis. The job of the rectum is to store the poop, and when it's full, it then tells your brain it's time to go number 2. So the proctoscope will be looking from the very top of your anus to the top of your rectum. So now let's look at the equipment, shall we? And I've got it right behind me. First, I'm going to describe the pieces of it, or the main core pieces. And the plastic piece that you see here is the part that goes into your bottom end. It's got some tick markers here because we want to be able to describe where it's positioned. Is it high in your rectum, low? And this piece obviously is plastic because it's disposable. It does have a plastic center which can be removed after it's placed into the bottom end. You want this piece here so that it can be gently inserted into your anus. The next piece is this silver metal portion here, and this is the eyepiece, because if you were to turn it around, you can see that this leads to an opening which goes all the way through to the end so you can look inside the rectum. It has a door flap here, and it's actually sealed here because this is closed so that we can hold air pressure in the rectum, and I'll explain later as to how that works. But this plastic piece that I was talking about, you can see that the end disappears as I pull out this plastic part, is designed to be removed so that when it's gone, we now have a clear view of what's in front of us. So you can see my hand, there we go, my hand is seen through the end. The last piece is, well, second to last piece, is this handle here, and this is plugged into the wall because this is our light source. The rectum is a very dark and mysterious place, and so you need light to be able to see what we're looking at. The last and final piece is this rubber tubing, and what is it connected to? It's connected to this piece here. Kind of looks like a bulb with a flapjack. And this is what we use to inflate and put air inside our rectum, because then it will open up the rectum and so we can see inside, right? So the rectum is closed when we're looking in at first, but then it opens up so we can see. And we want to be able to see the walls of the rectum, which is the most important. So now let's talk about how is it done. What are the steps of the procedure? The number one step which I think is the most important, is coaching the patient, making the patient feel informed and comfortable. This is not an everyday thing for everybody, you know, and it's not like each time you have it done it gets that much easier, because it's an invasive procedure in one of our most private areas, right? So staying relaxed, deep breathing is really going to allow your muscles to relax, and that way this procedure, while uncomfortable, should not be painful. Depending on the condition, however, sometimes the procedure can involve some pain, but definitely speak with your doctor so that you guys can be communicating together and make the process a good one. Because the whole idea, again, is to find answers, the diagnosis, so that a treatment plan can be started right away to make you feel better. After that's done, lubrication is placed on the end here so that it can be easily put inside, right? It's then probably about this point, you know, because the anus is about 3 to 5 centimeters long, and at this point we have a seal inside the bottom of your intestine. What happens next is the doctor will then remove this inner plastic piece, right? And you can see it's the length of the whole scope, right? So this comes out because what we want to do is now inflate the rectum, blow it up bigger so we can see inside. So this door is closed shut and closed tightly. Why do we need the system closed? Well, we're going to be putting air into it, like I said, and you'll start to hear this noise because air is starting to come through the eyepiece and all the way through and inflating this rectum up, okay? The rectum is not a straight shot like the anus is. There are actually some obstacles, some little walls in the way, and that's the way we're all born. So it is kind of like weaving through some S-turns, and you don't want to hit those and get hung up on them. So the doctor will need to use the light source to see and then open up the rectum with air. And that's what allows the doctor to then place the scope farther in until the very end of your rectum. The scope here is used to, again, determine a diagnosis and also to give you therapy options. And this is not a routine procedure like an anoscope is. Usually these kind of procedures are planned ahead of time because you need to be prepared for it. Not mentally I'm speaking of, but with your bottom end stool. You can imagine if you had a big ball of poop in there, even if you opened up the rectum, this scope is not going to see anything past that poop, right? So usually the doctor's office will have you do an enema or maybe take a laxative or something so that you can be emptied out and we can see the entire inside of the rectum. Those are the basics of the procedure there. I'm hoping that if you need to have this procedure done, you have a very thoughtful discussion with your doctor, and so that you can feel comfortable and it becomes an experience that is not a negative one. Once again, thank you for viewing this video. I really appreciate your time, and I hope that this video will help you stay informed and have some control over this mysterious part of our body. Thank you so much. I'll see you next time. Bye-bye.